Hey, everybody. Welcome to another episode of the Horse Geeks podcast, where we look at horses and riders from the inside out. I'm Kirsten Nelson, professional horse trainer, and back with me is my good friend Deb Romero, certified Alexander Technique instructor. So today's topic is recognizing pain issues in our
Mm,
horses, because I think that is misinterpreted a lot. A lot, a
interesting.
lot. And when we say pain, I want to kind of differentiate. It's just like, when you go to the doctor or you're in the hospital, they ask you to rate your pain between what, 1 and 10 or,
Something like that.
yeah, because there can be various degrees of pain, right? And it's the same for our horses. So something mild we could consider discomfort, which they can still become protective or defensive about, all the way up to pain where we can see a lameness issue. But by the time we can see what the vets would, they grade visible lameness or painful lameness 1 through 5. And by the time we can see a grade 1 lameness, there could have been a
Mm,
lurking pain issue long before that.
yeah, I agree with that. It's so subtle, we're not seeing it.
Yeah, because by nature, horses mask deviant movement. So they mask their pain as a survival strategy because deviant movement is what's going to attract the eye of the predator.
Mm.
So horses as prey animals, not all of them are stoic. Not all of them are like some horses can have a little pain issue and a huge reaction, just like people. And some horses can have a massive pain issue and they barely complain about it, just like some people.
I think
So
that's most horse people.
yeah, yeah, I know so
They
many
ask me
horse
a
people.
pain level of 1 to 10, I'm like, I'm still able to move. It's no
Yeah.
big deal. I gotta do barn chores,
I can
right?
still do the barn. I must
I
be
gotta do the
okay.
barn so it can't hurt that bad.
Yes. Yeah. So a lot of horse people do have like a very high pain tolerance.
Mhm.
And so many of us, it's like we get bucked off, we get back on because that's what we're sort of encouraged to do.
Yeah, we are.
And then we find out, I don't know, a day later, we have 3 fractured ribs or a concussion or something like that. I go, that's not that unusual. It's
All
funny.
all the endorphins wore off in 48 hours, so then things really start to hurt.
Yeah. Yeah. You hurt later. But, and with horses, it's like there's horses that can be having a severe colic episode and they just lay down and look quiet.
Mhm.
And then there's other horses that are thrashing around and sort of, the hoof on the forehead, like, oh my God, I'm in so much pain. And the vet comes and they're like, it's kind of a fart stuck sideways. It's not a bad colic. And they clear it right up.
And that's
And
a good point because to really know your horse,
yeah,
to really get, not just show up at the barn and ride and then leave. It's like really getting to know and have a relationship with them, because, one of my horses, when she's got an upset stomach, she holds up one leg and lifts her lip, and then I know, okay, it's a
we're
gas
starting the
problem.
colic.
We're
Yep.
starting a gas colic. And you gotta kinda hang around with them
Yes.
to get to know, you know, what those things might be.
Yeah. The other thing too is where a lot of people will get in problems is a horse that's pretty melodramatic or has a low pain tolerance. Okay, they're going to have obvious sort of symptoms of pain, like colic symptoms or, just holding the hoof on the toe like they couldn't
Mhm.
possibly walk. And it might just be an abscess blowing out or something like that. And so it's easy to recognize the more overt pain symptoms where we know to call the vet, even if it's
Right.
not a big deal, ends up not being a big deal. But it's the horses that are more stoic that kind of get by and they don't really show a lot of overt pain symptoms. And somebody else in the barn will invariably say, ah, he's okay or she's okay.
Mm,
That's not that big of a deal. If it gets worse, I'll let you know. And that's not really factoring in that some horses have a very high pain threshold. And so the
yeah.
longer you let it go, the worse it can be sometimes.
Or I also look at the horse that's the people pleaser.
That's trying to do what the rider wants no matter what.
Yeah, and,
Yeah.
does it's like, "Oh, I'm okay, I'm fine,"
Yeah.
"Carry on."
Yeah. And they're just a little like dull to the leg or hard to steer, or they're kind of
Yeah,
lethargic, or they're a
mhm,
little anxious and they're, taking in the environment. And that actually kind of leads to what I really wanted to talk about today is how we misinterpret sometimes
mm.
pain symptoms as behavioral problems.
Oh, that's a good point.
And it makes me crazy,
Okay.
because we're so quick as humans to say this horse is stubborn or this horse is lazy or this horse won't
Oh.
pay attention or this horse is ADD or, my horse is a little crazy or a little hot or something like that. And long before we see overt, obvious pain symptoms, there can be different degrees of pain from a little bit of discomfort to something that's really inhibiting movement.
Hmm,
And it shows up as either resistance, what we call resistance to our aids in the horse, or kind of a personality defect. It gets
right.
labeled a lot as poor personality or a behavioral issue. Like, no, that horse is just
Grumpy.
lazy, grumpy, yeah,
Puts his
unhappy.
ears back, right?
Yeah.
Yeah,
Yeah, and that can really be a pain indicator long before something becomes an emergency vet call.
right.
And it makes me crazy how often we label the resistance in the horse or the behavior as a horse as the problem.
Yeah. Or what I find in people, and you've had this experience that where we as humans see the, what we think is the problem is not the source.
Not the source of the problem.
Yeah.
Yeah. No, and I was even going to ask you when you have clients come in for Alexander technique, I know you've mentioned before that it's like there's an emotional shift. When you're re-coordinating the movement of the body, that you can have a big emotional
Hmm.
release, or you can let go of somebody who's chronically crabby or kind of Pollyanna. It's like that, those two kind of extremes, even in people,
Hmm.
can shift.
Well, if you think about, and I can only speak for humans, but I imagine it applies to horses. There's a real downward pull when you're in chronic pain, even if it's just like this little voice in your head of negativity. And what happens is with humans, we tend to focus on what's going wrong when we have pain.
Yes. Which
Yeah.
is a survival instinct.
Yeah,
Yes,
it's
we all
total
do it.
survival, and it
Mhm.
it brings you down, it kind of shortens you. You want to go into fetal, those kind of things.
Yeah, or I think even if you go through a hospital or a rehab center, you
Mm.
don't find a lot of happy, cheery people. There can be depression, there can be anxiety, there can be
Yeah, and you don't know
anger.
it. You don't most people don't recognize it at the beginning. Like with the chronic pain syndromes, that just adds up and adds up and adds up.
Yeah.
Yeah.
And that is when we talk about, say, optimal balance or optimal posture, like your business, What we're looking for is a mechanical coordination of the body that reduces those small repetitive stresses, the small repetitive wear and tear that are just the result of unconscious poor habits of using our body or the horse using its body that can create significant discomfort or
Mhm,
real chronic pain over time or pain issues. And I think humans express it exactly the same way horses do. We get
mhm.
cranky or we want to retreat from being social, or we get depressed, or we get anxious, or we have to control everything. It's like we just our defensiveness kind of escalates when we're in chronic pain, or even if we're sick, even if we have a cold. It's like we know we need that downtime.
Yeah, yeah, and I
So,
think that brings to mind that with people, and I'm wondering about this with when we think about working our horses, where, like you said, we don't consciously think about our everyday use, like when we're brushing our teeth, and all of those movements are so repetitive. Are we looking at repetitive movements in the horse and
oh, absolutely.
correcting, I don't know what language to come up with, but really like our work, my neighbors must think I'm crazy because it doesn't look like I'm doing anything when I ride.
Yeah, me too.
But, are we
While you're
looking at
dripping with sweat, by the way, too. Yeah.
that basic use, that thing that they do every day, which is walk, turn, can we improve those basics
Yeah.
so that when we do the upper level stuff, we don't run into a problem?
No, that's the whole premise behind how I train horses is
Right.
if we don't have like your work with Alexander technique, when I took Alexander lessons, I'm learning how to sit, how to get in and out of a chair,
Yeah.
how to walk around the kitchen,
Yeah.
how to pick things up in my best use. And so I go, those lessons were super valuable because you're
Mhm.
changing something on the inside. You're
Right.
not changing what you're doing externally, but you're completely changing the small repetitive damage you're doing to your own body
Mhm.
by not being conscious of how you use yourself. And it's exactly the same with horses. I go, we all walk, trot, canter, turn left, turn right, make circles
Mhm.
and straight lines, no matter what. So I go, the essence is, can the horse balance in three-dimensional body? Finding the most efficient coordination of the mechanical body, which leads to the ease of movement. And the side effect, I think it surprised me with the first horse, where I was really trying to change the coordination of the movement. And all I was doing was walking, trotting, cantering a little around an arena, and it looked like nothing. Excuse me, still getting over this cold. But that horse, which had been labeled as difficult and was given to a friend of mine who then gave it to me to ride, that horse that was labeled as difficult and dangerous just became a cupcake, like to where I
Aw.
could do demos and trail rides and all these things that were safe through the mountains of Austria, like not simple trail rides, right? And deer jumping out and steep mountains, and this horse was fine. And all I had done was my first attempt, which was rudimentary, at changing how this horse was moving. And the side effect of the personality, quote unquote, change was phenomenal. How
Right.
much this horse calmed down, how much this horse dropped all that defensiveness. And it was a powerful lesson in going, wow, this is huge to the horse.
Yeah.
This is one of the most significant things I could do with a horse was help the horse improve the balance. And as a side effect, I spent 10 years with cowboys and learning natural horsemanship and horse psychology. And it was like for every problem, I had this list of remedies. And it was like, it was so complicated because, and there's a lot of truth to understanding the psychology. But I go, there's way more to it than just the psychology. If
And
the,
what I
if
find interesting is when we hurt, we seek help. So what does the horse do? The horse, can't seek help. So the horse is going to, like you said, act out or
express
express it physically or verbally
behaviorally,
in their behaviorally in their own
mhm,
language. And yeah, we really need to know our horse well enough to look for those early signs of, something just ain't right.
yeah. No, and when it comes to labeling behavioral issues as personality, I go, look, when we don't feel well, whether it's a little or a significant pain issue or a chronic pain issue, we are not our best selves. Our personality, the way I would call it, doesn't even have a moment to shine through because we're defensive, we're protective, we're
Yeah.
just trying to get by. We're just trying to like get through the day with the least amount of stress possible because we've got all this internal stress going on. And the horses are expressing that when they're resisting the aids, when we lose steering, when they get heavy on the bit, or they get anxious in the mouth, or they pin their ears at us, or give us the side eye or the stink eye. It's like there's a tiny portion of that where they're defensive because they feel unsafe, because
Right.
maybe a deer jumped out or a pig showed up and there's an environmental stimulus that's caused a sudden moment where they aren't sure they're safe. I go, okay, that happens to all of us and all horses, but that sort of escalation into the the sympathetic nervous system, the fight flight response, I go, that's pretty temporary. And that's actually pretty easy to overcome if you're building a relationship of trust with your horse. To me, that's the much smaller part of training. But
Mm.
a horse that's chronically defensive, that gets labeled as having a nasty personality in whatever way, shape, or form,
Hmm.
or an uncooperative horse. I love that. My horse won't cooperate. I'm like,
What
okay.
does that mean?
Yeah. You mean your horse is not bending to your will? Okay.
Oh, don't get
That's
me
what that.
started. That's a whole nother podcast.
Your horse is not being obedient. Okay. And a lot of times, what we're labeled as disobedient, naughty, bad, resistant, all of those things can be the horse trying to tell us, I am not comfortable, at the
Mm,
very least, doing what you're asking me to do. Like, I'm not comfortable doing that and might even have a pain issue,
right.
right? So, like one horse, for example, that was chronically sort of nasty on the cross ties. Okay to ride, but not easy, like hard to steer, didn't really want to go forward, a lot of issues under saddle that made him not super easy to ride. But in the cross ties, the behavioral problem was that he would bite at people. He would pin his ears, he would nip,
Wow.
he'd sort of try to bite you when you girthed up. He wasn't easy to bridle, and he would get kind of aggressive in the cross ties. So we're working with reducing the defensiveness, and he kept having chronic abscesses at the same time. So finally, I'm like, you really need a full set of x-rays. This chronic abscessing is not normal.
Mhm.
Maybe you need shoes. Maybe something's going on. I said, just check it out, right? Because this is going on a long time. He had a bone fracture in the coffin bone on the front foot with
Wow.
chronic abscessing as a result. And it was like, yes, he needed shoes. He also needed major antibiotics and some time off to let the fracture
Mhm.
heal. And he still had a little bit of defensiveness even when he was healed because it had gone on for too long.
So long. Oh,
But
and I
that part was
that's
absolutely
huge.
easy to work through. I go, that
Yeah.
residual memory of pain and that behavioral pattern that sort of developed as a result, I go, that was actually pretty easy to work through once he no longer had chronic pain.
And that adaptability, I see, I think of it as like for PT for people, because we have to reprogram the movement. And what I see with horses is they're much more adaptable to relearning than people are.
I like to explain it as they're less complicated
Okay.
because our brains can easily live in the past or the future.
Right.
And horses have very strong memories. So the past can be brought into the present a lot, which means you have to sort of go to the exact context where the horse gets defensive and create a new experience within the moment because they have good memories, but they don't have good imagination. They don't have the capacity to imagine very far. It's sort of like, yes, no, I like it right now. I don't like it. I feel good. I feel bad in the moment.
Okay.
So when it comes to behavior, like let's say the horse won't stand still at the mounting block. Well, a horse not wanting to stand still at the mounting block could be the memory of being scared while being ridden and doesn't
Mhm.
want to be ridden because they now associate it with being afraid or being uncomfortable. Maybe they have a pain issue in the back muscles, in the spine, in one foot. Maybe it's a muscle issue. Who knows? But maybe when the rider sits on them, bearing weight is either uncomfortable for a horse or creates a pain issue for the horse
Right.
only during weight bearing. So that horse not wanting to stand still at the mounting block, if the horse is actually pain-free and comfortable, then asking the horse to just come to the mounting block and not get on and change that emotional response to just getting on the horse at the mounting block, that's easy. That's a matter of 6 to 12 repetitious sessions. I go, so they get over the memory of pain almost the second they have a better experience in the same context. But if you're slogging past 6 to 12 sessions and it hasn't completely gone away, you have a current pain issue, or you have a
That's a good way to
level
look at it.
of discomfort that's still going on. And
And
that's
I
kind
think
of
we
how I
have to,
know.
yeah, we have to come to the awareness that don't try not to set the horse up for failure thinking it's always going to be bad. You know,
Yes. And
that
that's what
this,
I mean when
yeah,
people say that's just the way the horse is, go ahead and
mhm,
get on. And they're saying that's just the horse's personality. That's
right.
what makes me crazy. Because I go, that horse is screaming at us that
He's
something is
screaming
wrong.
at us. I agree.
Yeah. Yeah. And the horse is either saying, I have such a bad memory of this experience that I'm anticipating something very
Mhm,
negative by the rider getting on, or I currently have a problem that nobody's noticing. So I'm going to get louder and louder and more
mhm.
obvious and more protective until somebody notices. And the
Yeah, and
scare,
I think as humans or maybe just Americans, the whole language around, "Oh, just push through it." You know,
yeah,
that
make
whole
him do it, make him
make them
obedient because he's an animal or she's an animal.
right.
It's like,
And we
no,
even do it to ourselves as
yes, we do.
athletes,
Yes, we do.
especially, I think I may be wrong, but most horse people are more type A. Um, and we tend to that whole language of push through it, push through the pain. I've heard that in the gym, I've heard that everywhere. Whereas, why don't we stop and evaluate what is it a pain issue? Is it a biomechanics issue? What are we dealing with here? Could we delve into that?
Right. What's that level? What's that horse's threshold? Like, is this a princess in the pea that just has a tight back? and is resisting meet the rider getting on because maybe needs to be warmed up on the ground before you get on,
Right.
right? And like one of the things that was particular pet peeve is I'll have horses that will escalate to the point that they get labeled as what's called cold backed.
I haven't heard that term in a while.
Yeah, so what gets called cold backed is a horse that is trying to like lay down, buck, or rear, or flip over at the mounting block as soon as you sit in the saddle.
Wow.
And I've had people tell me, oh, my horse is just cold backed, like it's a permanent condition that's unavoidable. And I go,
Wow.
like the term itself would lead one to perhaps consider that if the horse is cold back, then a warm up on the ground might resolve that problem. But instead, a lot of humans go, oh, that horse is just cold back. You just have to
Mm,
kind of get on and ride through it. And I'm
wow.
like, well,
That's
maybe we
scary.
could help, right? Maybe we could help. And to me, that's an extreme pain issue. When a
Right.
horse gets labeled as cold back, I go, you've got possibly kissing spine or a muscle myopathy issue, or you got something going on that is significant to this horse.
Right.
And one of the problems we run into is you can go down the very expensive rabbit
Yes.
hole of
I agree.
diagnostic work.
I agree.
That is kind of the scary part. Because one of the things about pain, like some of the more recent research papers I read on navicular in particular, is like navicular, you can have damage to the soft tissue. You can have adhesions on the deep digital
Mm,
flexor, or you can have a pain issue in the enthesis, which is where the deep digital flexor begins to turn into the pedal bone, right? It's sort of a half tendon, half bone tissue called the enthesis. And you can have wear and tear there. You can have a thinning of it. You can have a stress or strain, just like a tendon or ligament. And when you x-ray the horse, the pedal bone doesn't show a lot of damage to, or the navicular bone doesn't show a lot of damage, but there's a soft tissue
right.
injury that's creating a lot of pain, even though the navicular bone looks pretty intact. So you can have good x-rays when it comes to navicular with a very severely lame horse.
Right.
And then
And
you can have a pretty intermittently lame horse that has horrific x-rays with lots of damage to the navicular bone.
and
You
that's a
can,
good point. There's a lot of soft tissue in the body that, people always think it's a bone issue
yeah,
where it's like the the chicken and the egg. The relationship between the bony structures and the soft tissue is that tensegrity of if one's off, the other's off. And
yes,
it affects the entire body. It's not just that location. It's
right.
it's kind of like when you have an injury and say you twisted your ankle and you start limping and that catastrophically sets off your low back and so it's not if it can affect the entire body and not just that
Absolutely.
location.
No, a twisted ankle can also result with a sore neck, a sore back, a sore
Exactly.
hip joint. You're overloading the other leg all of a sudden.
Hmm.
And that's exactly how the horses are. And one of the sort of modern controversies, so to speak, in traditional medicine is that traditionally we think first there's pathology that we can find, bony changes or damage to soft tissues that we could see on an X-ray or an MRI or an ultrasound. And that's the cause of the pain.
Mm,
And the controversy now is that we go, no, we can have pain long before the pathology actually
exactly.
manifests. And I know you know that in Alexander work.
Hmm.
And I
Yeah.
think it's still pretty controversial in traditional medicine, even human sports medicine. But the frustrating part is your horse is screaming at you, something's wrong. You get the vet out. They can't find anything in the hoof or the two lower leg joints. And so they go, okay, now we've got to do different diagnostics. And as soon as you can't x-ray or ultrasound the lower limbs, maybe the upper neck of the horse and find pathology or find the problem, then you get into the really expensive diagnostics.
And sometimes I've noticed that it might even be something like we have a ton of Lyme here.
Yeah.
Lyme disease is, I mean, with my little halflinger, we tested him for everything, thinking it was a metabolic issue that was causing his
Excuse me.
abscesses. And what it turned out to be, he had chronic Lyme.
Yeah, and I've never
So,
seen limes manifest in two horses the same way,
no, and the same with people. It's the same with people. Or, we also have a lot of EPM in Virginia.
which
Um,
thank goodness now they actually have much cheaper, much
yes.
better
And it's
diagnostics.
diagnostics is better, and it's not, like a fatal thing if you catch it in time. But, like you said, there could be so many reasons why
Yes.
there's something going on.
Yeah,
So,
you're right. Between blood work and all these new, better tests for not
yes.
only like EPM, for Lyme's, for PSSM, the polysaccharide storage myopathy, you can test an X-ray, and even the X-rays that the vets are now carrying with them in their truck
Mhm.
are strong enough, the digital X-ray machines, that you can even X-ray deeper through the neck in the cervical spine,
Right.
or you can see the top of the thoracic spine to check for kissing spine or something like that.
Yeah.
And once the vet starts to recommend that you do these nuclear scintigraphy, MRIs, take them to the clinic, get the pelvis x-rayed. I go, cha-ching, cha-ching,
Yeah,
cha-ching. Now
big
you're
time.
talking big money. And once you go down that rabbit hole, I got to say, 9 out of 10 horse owners come back with an undetermined diagnosis. I go,
Yeah, and
because,
then and that's kinda like the conventional way of looking at it, and there are alternative ways to look at it. Could it be something as simple as the toes are too long? You know what I mean?
well, and that's what like the easy breezy thing to do with your local vet is get x-rays of,
Have a
even
baseline.
have
Yeah.
a baseline so you know if there's changes in the hoof and in the lower legs that are easy to see, easy to recognize. And, even with a ultrasound, they can look for tendon and ligament damage.
Mhm.
That's easy. Um, we'll have to talk about your horse that ended up with the the neck arthritis that showed up as intermittent lameness on the left front. So
Mhm.
that can happen too. So if they, like, if I check, I always start with looking at the feet because a lot of lameness is going to be in the feet or the lower limbs or the lower tendons around the cannon bone. And if it's not there, then I would check the neck, I would x-ray the back, all of those things. And then the blood tests for allergies, EPM,
Yeah, I mean,
Lyme's, all of that is still in the reasonable price range of
mhm.
diagnostic work. And even like Cushing's tests or
Yeah, some
insulin
metabolic issues.
resistance,
Yeah, a metabolic
um,
panel.
right,
Good
all
to
of those.
I do that because my horses are getting older, and we forget, that those things can enter into the conversation when we get horses in their 20s.
Hmm.
I have my horses tested twice a year because they're all metabolic now. They're all in their 20s.
Yeah.
So,
And by understanding how to guide, whether it's the human or the horse, how to guide the body into more optimal mechanical coordination, that can also resolve discomfort or pain issues that the vets can't necessarily address.
right.
So
Because,
I use the vet for everything the vet can do, believe me. But once I get into the you need to ship your horse to the clinic, other than an emergency surgery, I go,
right?
okay, now I'm going to push the pause button and I'm going to
Right.
see if I adjust the training, can the horse start to change the coordination, reduce defensiveness, find more comfort? And that's the realm of rehab training. I go and I've seen it work thousands of times, so I know
Yeah.
it's possible.
It's the
It-
same with people.
yeah, and then like even with the pathology, my horse that has navicular and ring bone on the right front leg or right front hoof, it was like that's not the leg he goes lame on anymore. That pathology is not where the pain is. And if he goes lame now, it's always on the left front and
Interesting.
it's intermittent. So I go, if I x-ray him, it'll be the neck.
Probably.
Yeah. I go, so, but everything I do with him involves reducing muscular tension through the neck. And as I've focused on that, guess what? The intermittent lameness went away.
And I think that's and we have all those diagnostics from the vet. That's like static diagnostics where we're looking at it as an Alexander teacher. I'm looking at movement, changing movement patterns.
Yes.
Um,
That's exactly what I look at.
yeah,
Because if you don't change the mechanical coordination during motion, you're just aggravating the pain issue until it can become pathology,
yeah.
right? And even, like the make me crazy thing, once again, I've had vets tell me because the diagnostics didn't show anything. Oh, he's just that way. That horse is just an
Wow.
ass, or that horse is just stubborn, or that horse is just resistant. That's just a behavioral issue. It's not a pain issue. And so it's frustrating because a lot of horse owners will be told that by a lot of vets. And I go,
Hmm.
just because the vet couldn't find anything, the good
Doesn't
news to
matter.
me is if the vet can't find anything and tells you that your horse just has a nasty personality, then I go, great. I've eliminated anything that
Right,
I could
right.
address through veterinary medicine practice or things. So I've at least eliminated something that only the vet could help me with. And now I go, okay, if the vet can't help me and I'm getting my horse is getting the label of having a nasty personality, now I know it's more of a movement issue.
And maybe seeking alternatives like an osteopath, a chiropractor, massage therapist, orthobionomy, whatever,
Yeah.
address it soft tissue wise. Is there an imbalance left to right, or
Yeah, because there's a lot of alternative treatments that can be
hmm.
very effective when the vet can't label something easily.
Right,
And it's so funny because some people are strictly like, I only listen to science and the vet and the provable, and I don't dabble in this sort of semi woo-woo stuff. And other people are, I'm completely natural. I would never use the vet. I wouldn't use medication or put shoes on my horse or get vaccinated. And it's like, look, I look at my horse, which is part of my family emotionally, and I
right.
go, I'm going to try everything and anything.
Exactly.
And I'm going to be pragmatic. I'm not going to throw things at my horse with wishful thinking. I'm going to see what does the horse respond to. And it opened me up to a lot of different pain management strategies or things that I might not understand, or we might not have the science yet to explain it, like
Right.
acupuncture. Acupuncture
Exactly.
was like in the woo-woo category for years until we started to have the instruments that could measure and understand it.
Right.
But it's been working for thousands of years,
Exactly.
So I go, there's that part of science where I go, I don't necessarily rule it out just because it hasn't been proven through science yet, because science by definition is a little slow.
Yeah.
It's a little
Yeah.
slow. And like craniosacral work, I love acupuncture. I love the Alexander technique. It's like there's still people out there trying to prove exactly how that works,
Right.
but the results, the clinical results are all there.
Right.
And I go, at the end of the day, that's what I care about. For this
Right.
unique body, can we overcome chronic pain, right? That's maybe different than an accident or an injury, because a chronic pain issue is much more related to like what you're talking about,
Mhm.
changing the movement during motion.
Right. Yep. And it could even for people be, unfortunately, a sleep pattern, which is really hard to deal with.
Yes.
Yeah.
Yeah. And that,
And to know your horse and, actually be their advocate, educate yourself about what other options are out there and be in tune with your horse and how, their normal daily routine is.
well, and it's funny you mentioned sleep too, because my sister, the equine vet, was telling me about this research paper and a lecture she went to at one of the vet conferences that there is such a thing as sleep deprivation in horses that most often happens in a group of geldings without an established leader of the group
It makes so much
because
sense.
oh my
Cut that
God.
out and go to bed.
Yeah. So the way horses sleep, because they'll sleep for 20 minutes at a time, 30 minutes, when they literally lay down and have their REM sleep, right? They can
Mhm.
sleep standing up, but it's more like a lighter, dozing kind of sleep. But they do need, I think, over the course of a full day, 4 hours of that deep REM sleep,
Wow.
right? And so the way a herd works is when the mare is up, or the mares are up, the stallion or the geldings, then it's their turn to lay down and have a deep sleep. And then when the mare lays down, the boys are up. So somebody is always the sentinel standing guard.
I always see one standing in the pasture.
Always,
Always one standing
always.
at my house.
Yeah, that's every herd. And so the sleep deprivation comes up. It made me kind of laugh and picture this group of goofy geldings who can't decide who's in charge, right? Nobody knows when to lay down and when to stand up, and they can't get organized. And so the whole group of them winds up with sleep deprivation, which
Wow.
I go, who would have ever thought of that? That the horses just can't figure out who's supposed to stand while the other ones sleep. And even in the barn, like my horses are in at night, but if I go in the barn late at night, there's always somebody standing while a couple are laying down and sleeping. They're never all laying down at the same time. And I have
Interesting.
startled the sleeping ones by accident,
Yeah,
where
I
they're like,
bet.
yeah. And they're like, oh my God,
What are
and
you
they
doing here?
jump up because I made a noise and they were in a deep sleep.
Oh,
Yeah. So I go, things like that. Like I assume now that if the horse is not in the fight flight nervous system, if I see the signs that the parasympathetic nervous system, the rest and digest nervous system is really becoming dominant, but I still have what we would call behavioral issues, especially over time. Most behavioral issues are resolved in 3 sessions. I go, the really bad ones can take 12 sessions, but it's not that hard to solve behavioral issues. And what really takes the time, or what makes a behavior so chronic it gets labeled as a personality, is a pain issue.
right.
Even if we just said the horse is uncomfortable, right? They still don't want to do it because they're uncomfortable in movement.
Hmm.
I go, that's the larger part of the bad behavior to me. And so when I get called in on behavioral issues, I'm already looking at what does the movement look like? How is
Yeah.
the body developed? What does the hair, skin, and coat look like? All of those things are sort of indicators that there might be a physical issue lurking underneath what appears to be a behavioral issue. And I don't know. Most of the time, I've got no freaking idea what it could be.
It's
And so I
it's
go,
not
but
simple.
we can train, like even that sort of stand still and look at me exercise was because I had to calm down a lame horse. What am I going to do? I can't use movement. The horse is lame.
Mhm.
And if I don't get the horse to calm down, he's going to injure himself stall walking or blowing up or rearing while I'm trying to hand walk. And so just standing still and making that connection with the horse can help reduce the anxiety or the tension. And I go, that is the safest thing I could possibly do.
Right.
Right. And then in hand walking or hand walking with a purpose or there's very simple things you can do that aren't going to add to some unknown stress in the
Mhm.
horse's body. And I go, if we start there, then the horse starts to show me where the resistance increases, starts to tell me where the discomfort might be coming from.
And, it possibly could be how the rider is using themselves.
Absolutely.
Yeah.
Or the training method they're
Or the
following.
training methods. Yeah, all of that. You
Hmm.
have to look at all of it.
Yeah, and with the best of intentions, we don't always realize how much discomfort we could be causing our horses
Yeah,
because it could be the dynamic use of the two bodies in motion, aside
exactly.
from has nothing to do with the saddle or the bridle or the footing or the environment. It's like, no, it's just happening between two bodies only
Right.
when you're in motion.
Yeah.
And that's where it's showing up, but it's still creating enough discomfort that the horse is like, I can't do this.
Yeah.
I can't do it. And then again, we've checked the saddle, we've checked the bridle, we have the dentist, we have the vet, we have the body worker, we have the right
Check,
nutrition.
check,
We've
check.
checked all those boxes and our horse is still resistant or not performing well. And I go, well, good. At least you've checked off all those boxes. You've
Right.
eliminated all of that. So what that probably means is it's between the use of your body and the horse's body in motion.
Right. It's a big deal.
Yeah, and I specialize there like you do because nobody else does.
Nobody
I go, there's a big gap there where
the
nobody
big gap.
really, yeah,
Mhm. Yep.
yeah. Anything else you want to add to wrap it up?
Nope.
But I think talking about pain, like especially, I think way back when I was in the apprentice program with Pirellis, what fascinated me was we would get these horses labeled as difficult, even within the sort of natural horsemanship realm. We had this hierarchy of easy, medium, difficult. And as an apprentice, our job in the apprentice program was to make the difficult ones easy. And totally by accident, my original alert to this idea was without fail, every single one of those horses that got the label of difficult ended up having some obscure, hard to detect, hard to diagnose,
Wow.
weird problem physically that perpetuated their behavior as difficult.
Mhm.
And I go, sometimes it was an osteopath who found it, sometimes a farrier, and the horses had already been through lots of normal veterinarians and diagnostics.
Right.
So it was like the Chinese medicine woman found the problem, or the
Right.
craniosacral person found the problem. And that's how I met one of my mentors who is an osteopath who showed me, like you did at Alexander Technique School, sometimes it's just the movement that's
Right.
creating the problem.
The repetitive bad use.
Yeah,
The
that
easiest way to
repetitive
put
wear
it.
and tear.
Yeah,
Yeah.
and that wear and tear. For instance, something real simple like look at you guys don't have a lot of stairs there, but um when you go to get up in the morning, you always turn to get out of the bed the same way. You always put your pants on the same way. I mean, looking at all those things is what slowly breaks down the body.
Yeah, or my dad, with his personal trainer, having to relearn how to get out of a chair without using his arms
Yeah, oh, that's huge. Yeah.
because that was just such a habit for so long
Yeah.
and it weakened his
It's
body.
totally you lose all integrity of the body that way. And that's why with Alexander's school, that's what the big thing we do is in and out of the chair because all your habits are right there.
Yeah. And a chair without handles and a very hard seat.
Yep.
That darn chair
That
exercise.
darn chair exercise.
I know. But it does. It's sort of because the body's in motion, getting in and out of the chair, it's like everything shows up.
Yeah. Everything, every bad habit shows up.
Yeah. And that transition from sitting to standing to sitting is where it shows up.
Mhm.
Awesome. All right, you guys. So thanks for joining us once again. And welcome to the new subscribers on YouTube. And if you're on YouTube, I did find out I cannot do the community thing I was hoping to do until I have a
Aw.
thousand subscribers.
Wow.
Like they have this limit, and I go, that could take a long time. But um, but I'm happy we're like pushing 200, which for me is huge.
That's huge.
It's huge. But if you guys would like to see a community on the YouTube channel with more sort of detailed information and lessons, it has to get up to 1,000 subscribers before
Wow.
I can even do it. So I learned that this week and I go, okay, might not happen right away, but I thought I'd put it out there for any of you YouTubers that would be interested in having more proprietary information in a community. All right. So thanks again for joining us, and we look forward to seeing you on the next episode of Horse Geeks.
Bye, everybody.
Bye.